Hello and welcome to Fecal Vet Chat. Tonight I would like to take you to Warsaw, to Poland, where two of our members are running a referral clinic for nephrology and cardiology patients. So good evening to Magdalena Krainska and Dorota Morawska.
Good evening. Good evening, guys.
So let's talk a little bit about you and your work. Before we talk about your referral service, just tell me a little bit about yourself, how you got into veterinary medicine. I know that Magdalena, you studied in Lublin, I think, and Dorota, you studied in Warsaw. Is that correct?
Yeah, Warsaw, yeah. But we met in Warsaw, you know, because this is funny story, and this is how our friendship began. Because during my university, I decided to move to Warsaw, and I went on some student exchange on the fourth year, and I have met Dorota, and here we are. That's 4 years later, let's say. We will not say how many, but we are together. We are working together as well, because Dorota has got own clinic, and but we are still sharing some best memories from this time in university.
Yeah, but actually Magdalena started in Lublin and I started in Warsaw.
Yeah, we are both from family where our parents were vets. My father is a vet.
Oh, right. Your father as well.
Dorota,
yeah, okay. Yeah.
Yeah. And my father, he was a vet, and my mom, she's a vet. Yeah.
So it was like you have to do that after you take it. So well,
you take it with your blood, you know, or with your milk from your mom.
There are no surprises then. You see, in my case, it was so that I have to admit, sort of, when I started with veterinary medicine, I didn't have a clue. I had been once or twice out with a veterinary surgeon doing a little bit of large animal practice. My parents, absolutely no connection to veterinary medicine. I was a complete greenhorn. I mean, you guys knew right from the beginning what you put yourself into then. Mm-hmm.
Yeah, but
we knew and we didn't.
You know? We didn't. If you are not practicing, you don't have any idea what is to work as a vet.
And the times are changing, you know. So when our parents were working, they are still working. Yes, Magdalena's father is working, my mom, she's working also, but like 30 years ago, it was completely different in Poland. So I think the image of veterinary was also different.
Mm-hmm.
But still, it's very nice to speak with our parents and just to you know some history of the veterinary, and also our basics, I would say, are from our families, from our parents, because I remember when I was performing my first surgery with my father, and he was teaching me how to do that, how to keep the sutures closed, you know, everything. So I think they gave us this love to the veterinary, this positives. And that's why we decided to grow up and to be the best.
I tried the same thing with my sons. I have two sons, and since they were little, I sometimes took some of my patients home if they needed fluids overnight. And then if it was a dog, I had to be walked in the garden, and then they had to go out sort of with a fluid bag and walk the dog, so they were used to it. And it was not uncommon that we had a dog or a cat staying with us overnight, because I didn't want to leave it in my clinic. But it didn't work out. They both went in completely different professions. So I tried hard, but it didn't work. To get that now right, as far as I understand, the clinic you are both working in, that's originally your mom's clinic, Dorota, or the clinic of your parents? And
My family, yeah.
yeah, and Magdalena, you worked
I'm
initially
working,
at the
I'm
university in a referral capacity, and now you're working in private practice.
Yes, I'm working in practice, in private practices. I'm working in 4 different practices in Warsaw. My role is more like a specialist, doing only nephrology and urology cases and soft tissue surgery. So I'm not only with one clinic. And this is very common in Warsaw to work in that way for specialists.
Yeah.
But I'm glad that I'm working with Dorota as well.
I think both nephrology and cardiology, I personally felt, you see, the clinic that I had here in the UK was predominantly first opinion. And I had a fairly small clinic. I was just working there with one colleague, and just a mile or two away from us was a really nice large clinic with 7, 8, 9 vets. And yet I had a lot of clients coming to me actually because of continuity. And I thought, well, fields like chronic conditions like failing kidneys, heart disease,
Yeah.
or oncology, and possibly also dermatology, these are areas where I think continuity of care is just so important. And I think that is where possibly really large clinics sometimes fall a little bit short. Do you think that that's the same with you?
Like the first contact clinic is having the patients. They are trying everything in a good way just to figure out what is the problem. And if they have got some troubles with giving the diagnosis or with the treatment, they are like sending the patient for the consultation. And this is our rule, that I'm performing the consultation, I'm checking everything, I'm preparing all the treatment, and mostly I'm sending back to the first contact clinic these patients with all the instruction, what to do, when to is necessary to check the blood, for example, or urine, or making ultrasound or whatever. And I'm making also the recheck. So I'm recommending, okay, it will be nice to recheck with me after, for example, 2 weeks, just to see is it better or not, if we have to fix something or change treatment. And is working in a very good way. And I'm trying to have a very good relationship with other vets as well, because I know it's important to cooperate together. This is absolutely something which I'm really working on in Poland, because we still have got some difficulties to send the patients to another vet, because we are worried that this client will not come back. Yeah. So this is my point, that absolutely I would like to send back the clients with all the recommendation and instructions about the treatments. And I hope I think it's the same with cardiological patients.
Yeah, with the cardiology patients, yeah, it's the same. But when I'm thinking about the clinic, for example, in my clinic, where Magdalena is making consultations, we have a pleasure to work with very good specialists. Yes, so we have orthopedic, we have dentistry, we have nephrology, urology, surgery, so we have very good internal medicine, we have cardiology, so we can give a lot to our clients, to our patients. So not many patients we are sending to another clinics, because it's not necessary for us, yeah. But in the neurology, oncology, yes, we are sending. Yeah.
That's good. I mean, both having the specialist on site is good, but just also communication is key. I mean, with my own clinic, it was always so. I have a rough idea how good the level is to where I can treat, and as soon as I realized, sort of, okay, this is above that, what I can provide decently, then I'm in the lucky position here in the south of England that I have so many good referral clinics. And the key is really communication. I might have a really good specialist around the corner, but if he or she doesn't communicate with me and with my clients, then they are not good to me. They are, then I will not use them. But it gave me the possibility that I could always say to my clients, I'm afraid we have reached a point here where I think you will get better care elsewhere, and I would like to refer you somewhere for a second opinion. And I cannot recall a single client who left my clinic because of that decision. They were all appreciating that I was honest to them and that I said, well, this is the level to where I can provide decent veterinary medicine. The rest is too much a touch and go and taking chances or risks, and it will eventually come back to you. If you finally mess a case up and you think, well, there are other people around me, they would have done a better job, and I didn't refer in time, you will not get, well, it will reflect on your clinic, definitely.
Yeah, yes, exactly.
Many times during the week, even today, I had a patient, it was a cardiology patient, but of course I have many questions because I'm doing internal medicine also in my clinic. So I have always another questions, not only about the cardiology cases and about orthopedic, or when I see there is some kidney disease or something, I'm just saying, sorry, it's not my area. I have better people for that. And when I say that, the people are very happy because they don't judge me. They don't think that I'm stupid. They think that I'm kind of nice doctor, honest, yeah. And I want to do the as much as I can for the dog, cat.
Is a good, very good quality of service.
Yeah.
And I think we are too rough to each other, in the meaning that we cannot know everything. The veterinary field is so huge nowadays because just look, in 10, 15 or even 30 years, the veterinary field just grown up so quickly. And in really small area, we have got so many treatments, so many like innovations, and you cannot do everything. It's impossible. It's impossible to be the best in everything.
How important is for your clinic and for your services these days social media?
The times changed, yes. So when our parents were working 30 years ago, it was completely different. And now social media. My mom, for example, she doesn't know
what is Facebook.
No, Facebook, she knows she's on Facebook. Yeah. Really?
Facebook.
No, she knows that. But Instagram for her, it's too much. And I understand that. But I think social media now for vets, for veterinary clinics are very important because they can show also what we are doing, yeah, what is our work, so we can show to clients. And I think it's very important because people, maybe they will have more knowledge about what we are doing, not sometimes not in front of them, but sometimes behind the door, you know, and how we care and how we treat the animals. I think it's very important and it's nice.
Yeah. Not always you are able to speak about everything what you are doing, in the meaning that after surgery the patient is recovering, and okay, how is recovering? Is recovering with another vet or technician on a very soft like blanket
with
somebody,
the pillow, you know.
And there are small things which are making this hole in a hole. So I think social media can give us a lot in sharing what we are feeling, about our emotions, about our the way of treatment, or some sad even moments. So
think also it's good moment to educate people, yeah, and to educate them and give them idea what can be with their dog or cat.
So this is also a very good way of presenting yourself. Who you are, what you are doing, where you are working, what you are doing more after job, for example, because we still have different kinds of life as well after our job. So I think we can, time to time, not every day, but I think it's always nice to show different side of us. Like we are still humans.
We are not only vets.
COVID, how has that affected the work at your clinic? Are you allowing clients in the clinic at the moment, or are you seeing them outside? How does that work?
It was different at the beginning and it's different nowadays. At the beginning, we were trying to keep clients outside the clinic and to take care only on patients, and after that speaking with them on the phone, explaining everything and preparing all the information instructions on the paper or sending by email. But I think nowadays we are more into working also with the client inside, but only one person can be in the room with animal. And I don't know how it will be during the next week, because, you know, we have got so many cases of the COVID in Poland, and we want to work, we need to work, because there is a need for vets to work, because there are so many animals which are asking for help. And I don't know how it will be. In fact, I don't know.
But I think it's also when we can compare the March, April time, we were, I think we were a little bit more scared, you know, like it was something new, it was COVID. So everyone was completely, we had like 300 cases per day in Poland.
Yeah.
So it was nothing, but everyone was so scared that really the rules of treating and how we were cooperating with clients was different. That the people were standing outside the clinic, leaving the dog, like Magda said. But now I think people are a little bit already tired because of COVID, you know, because everything is all the time restrictions, you know, and some of the people, they don't believe in this, some of them they believe.
But also I think people are more well educated how to behave, in the meaning, if they are coming, they are wearing mask, they are like cleaning hands, and they are trying to keep the distance. So they are really much more well educated. So if somebody is not able to keep distance and to clean the hands wearing mask, we are saying, I'm sorry, we have got this protocol. If you are not able to join this protocol, we cannot work, we cannot cooperate. So if you want to be our client, just follow it. And people are understanding that, and they are saying, sorry, yes, okay, let's try it again.
Because after 5 months already, they started to be used to. So the mask is so normal thing on the street and in the clinic, everywhere.
What not everybody knows who comes to your clinic is that, I mean, you have not only been working in Poland, but and there we share sort of a similar history. So you have also done some adventures or trips to Sweden, and you worked over there. How would you say, what was for you the largest difference?
I started to go there, but after I took Magdalena, and actually talking about friendship, it was very good, nice time for us.
Yes, it was absolutely
because we were all the time together. And actually we were so shocked that we are like almost 24 hours together, because from time to time we have we were working in different area, yeah, but you know, almost all the time. So we were cooking to each other, cleaning the house, like
going by bicycle, cleaning, working, you know, changing, checking which type of patients we have, you know, discussing about the patients.
So that's why it was different.
Yeah,
because we were different in different ways. Yeah.
And we like to work together because we are like from different areas. And you know, if I have got the difficulties with the cardiac patients, I'm asking Dorota, what I have to do? Oh my God, you have to help me. And it's the same, for example, with surgical patients. And it was really nice. But what was the biggest shock for me? I think life balance, that they are really keeping balance in working and keeping free time after work. And I'm really in love with that. And they teach me a lot how to work in a good quality. Of course, it is very good quality of working, but without hurry, just to keep time to think, to organize everything, to prepare the treatment, to ask somebody if it's necessary. And what I noticed, that absolutely it gave me much more good results than when I'm doing everything in a hurry, like in Poland, because in Poland I'm always in a hurry. And I noticed that in Poland I make much more mistakes, and after that I'm coming back home, not spending time in free time drinking tea, but thinking, oh my God, I made this and this wrong because I was in a hurry, because another patient was calling to me, because another patient was waiting. And in Sweden, it was very nice to work in a very comfortable way.
Yeah, but I think it's because, first of all, we were in a big hospital, there. So there were a lot of vets and there were a lot of nurses. So each vet had his own nurse. So it's like a pleasure to work because you have your time to think. You are just coming, doing a clinical exam, and then you are coming back to your computer, and then you can think. And your nurse, which they are amazing, they are doing all the hard stuff. And in Poland, not every clinic and not every vet can have a nurse. This is life in Poland. So most of the time, we vets, we have to do almost everything sometimes. So you have to be in hurry. So this is completely different. Of course, it's changing, but the thing is that in Poland, they are different. We have different prices. And in Sweden, they have different prices, and they have money for this. And another thing is that quality of working there, it's good because people are very calm. And we in Poland, we are like, like Italian way, a little. So we are like that. And
a lot of
expression, and Sweden is very calm. So you have time to think, and they can tell you that, oh, don't worry, we can wait. And
I love the clients. Swedish people are so kind. I love them. Absolutely, I love them. They can wait hours.
I have here in the UK occasionally Polish and also German clients, and I know I think we are just by nature, we are sometimes a little bit, what shall I say, pushy, maybe not quite as diplomatic, a little bit more demanding, something like that. So, I know exactly what you talk about.
What Sweden gave us, I think, antibiotics. Do not use antibiotics.
Do not use antibiotics.
And this is something which absolutely I have changed all my attitude to the antibiotics. I'm not using antibiotics. I'm only using antibiotics after culture. And this is something which I'm trying to teach my students or vets during the workshops. And I think this is absolutely important.
Let me finally talk about, you already scratched on it a little bit. So come on, if your life, when you're not vets, how do you manage to relax, to take your mind off your day-to-day work? So what are your hobbies? What is your passion outside of veterinary medicine?
My biggest hobby is music.
Okay.
Yeah, so it's like half of
She's
my.
a singer.
I'm a
What
singer.
kind of music?
Let's say it's electronic music, but very smooth electronic music. Yeah, and I still remember because I started to sing when I was 7 years. Yeah, and then I started to play piano. And when I got to veterinary studies, my mom told me, "Oh my God, how you manage that? Oh my God, singing a band, rock band, because then I had a rock band and veterinary medicine." She was like so afraid, and I said to her, "I will manage that. Don't worry." So through all the studies, I had a rock band. After I had some electronic band, and after I had another band, and still all the time yes, I'm singing, and I had a contract with Universal Music, so
she's quite popular. In
no.
Okay, sort of.
You have to find on YouTube Lali, and you have to listen to her. When I have got free time nowadays, we have got COVID, so I cannot travel. If in the past, I was traveling a lot because I love to explore new culture. And what was funny and why COVID destroyed all my plans, because I was preparing to go to Mexico. And I'm really angry on that, because I was so into explore this country with the language, with food, with all the culture around, and dancing, because I was dancing when I was younger. You know that as well?
I know that.
Yeah,
I still remember that. So I always say the Poles, they know how to throw a good party, and they know how to dance. So yes, I have very fond memories of a nice veterinary congress in Łódź. Yes, yeah, and good dancing. Yeah.
I was a professional dancer, so it was from my past. That's why I know how to move time to time.
So you were cheating. No. So you had prepared. No, it's very, very good.
This
yeah.
Time to time I'm bicycling, making some sports, and that's it. Cleaning my house.
I also like to cook, and Magdalena knows that, because she was eating food which I prepared in Sweden.
Maybe one day we will meet again somewhere in Sweden, so where we work at the same clinic or so, and then I will come back to the cooking thing, and maybe to the dancing thing as well. Yes.
Yes.
Okay. Magdalena, Dorota, thank you so much for joining me for the Fekava Vet Chat. If anyone has any questions or comments, you can email us on vetchat@fekava.org. You can certainly also comment on our social media presence. Next week, we will surprise you with another interesting guest. I won't tell you who that will be. Just stay tuned and take care and stay safe. Bye-bye.